Well, thank you so much for joining Get Back to Sleep, a webinar for youth and young adults with anxiety-related sleep problems. My name is Emily Ricketts, and I'm an assistant clinical professor in the Department of Psychiatry here. I work in the Child OCD, Anxiety, and Tic Disorders program. Let me just minimize my box so I can see my stuff. Okay. So today I will provide just an overview of sleep first, and then talk about common sleep-related problems related with anxiety and how to recognize them. And then finally, I'll review sleep hygiene-related and other strategies for managing both general and anxiety-related sleep problems too. So first, I just want to start with the sleep overview. So I do want to talk about sleep stages. So sleep can feel like a mystery, but it is an active process. So there are times when the brain is fairly active, and then also times when the body is active too. So there are 4 stages. The first 3 make up what's considered non-rapid eye movement sleep. So during stage 1, that is a very light sleep. So you're just, it's more like a daydream. It's right after you drift off. You can still hear voices. You may still have thoughts. If someone, if you were watching a movie and drifted off into this stage 1 and somebody were to wake you, you would swear, no, I was awake, So that's stage 1. And then stage 2 is a light, dozy type of sleep. So your body relaxes, your body temperature drops, and then your heart rate also starts to slow. And if you were to wake up during this stage, that would probably be the best stage to wake up during, and you would feel the best. Now, stage 3 is considered deep sleep, also termed slow wave sleep as well. During this stage, your brain and body are undergoing recovery. Your muscles relax, your blood pressure and breathing rate drop as well. So, if you were to be woken up during this stage, you would feel really, really groggy. And so we work down through those stages and then back up through those stages to reach REM sleep. So during REM, this is when there are rapid eye movements. Your eyes are darting around. Your brain is active during REM, but your body is paralyzed. So you do tend to have vivid dreams. And if you were to be woken up during this stage, or if you were to naturally wake up, you would feel, not super well rested, and you may remember your dreams a little bit better. So yeah, the point is that, sleep is really like a roller coaster, and we go through these different stages. Okay, so I do want to touch on 2 sleep processes. So we'll start with one of them. So this image is really just referring to our sleep drive, our homeostatic sleep drive. So all that this image is really showing you is that, the longer you've been awake, the greater drive there is to sleep, the greater pressure there is that builds to sleep. And this relates with a neurotransmitter in the brain called adenosine, which does accumulate across the day. And so when when we do go to sleep, there is this pressure is relieved, and then it starts all over again the next day. And then the other process is our circadian rhythm. So, our circadian rhythm ultimately aligns our sleep and wake activity with the night and day cycle across approximately 24 hours. And I say approximately because it's more like 24.2 to 24.5. It really just, it depends on the person, but it's not exactly 24 for humans. And so yeah, our circadian rhythm, it's really housed in a part of our brain called the suprachiasmatic nuclei, which is in the hypothalamus. And that's considered really our master clock in our brain. And so in addition to regulating, sleep-wake activity. It also regulates body temperature as well, and melatonin, which rises in the evening, cortisol, which tends to rise which does rise in the morning, and yeah, and also eating patterns too. So, and brainwave activity. And so light is the strongest influencing factor on our circadian rhythms. Through our eyes. Ultimately, we have intrinsically photosensitive retinal ganglion cells, which are sensitive to blue light, especially. But yes, that's ultimately how light is influencing the circadian rhythms. And but yeah, in addition to light, there are other factors that do influence this rhythm. So the timing with which you eat is one of them. So the timing of your meals, exercise is another one, temperature as well. So there are some other factors that do regulate our circadian rhythm. So I want to touch on sleep and how it changes across puberty or adolescence. So ultimately, what tends to happen during adolescence is that there is a delaying of our circadian rhythm. It shifts later. So this is why, people complain about teens going to bed really late and, staying up until all hours of the night and then sleeping in until, noon or maybe thereafter. And so this is something that is naturally happening for all teens, really, but for some, they are more affected than others. And in addition to that, there is also a pattern of slower building of sleep pressure during adolescence as well. So that sleep drive, the accumulation of sleep pressure is a little bit slower. And then also there are some reductions in slow wave sleep from childhood to adolescence as well. And then so in addition to those sleep and circadian related changes, there are also some other things that are happening during adolescence that interfere with sleep. So homework burden is definitely a big one. So homework and projects, there may be, school may become harder for some. And so that can cause challenges in homework completion. A lot of individuals are engaged in extracurricular activities. So that's ultimately either requires, afternoons or evenings, or sometimes early mornings for practices and games. In addition, we do have, the issue of school start times, which there has been years of work to try to address this, and there has been some success in pushing back school start times. But yeah, historically, that it seemed like the adolescents or high schoolers had the earliest start time out of, between middle school and elementary school. And so, ultimately asking them to wake up that early just creates it just leads to a very short sleep duration during the week. And then on the weekends, there's all this catch-up sleep. And, that cycle ultimately leads to what we would call social jet lag. And so, you can think of it like when you feel jet lagged from flying, flying across several time zones. It's ultimately similar to that, but it's especially at the beginning of the week, your social timing is really different than your biological timing at that point. So and then technology use is a big issue as well for multiple reasons, and so I'll get into that. So how much sleep does one really need? So so in adolescence, 8 to 10 hours is what is recommended. Ideally, I guess on average 9, but usually adolescents tend to get about 7 hours of sleep. So they're not getting enough, that is for certain. So, for adults, what's recommended would be 7, at least 7, likely, 8 as well. So, but yeah, I think the important thing, just going back to that, would be about sleep duration is, there's no hard and fast rules, and ultimately it's how you feel. So, there are some people who are short sleepers. So they function well off of, for some people as short as 5 hours of sleep, which is rare, but it can happen. And they feel fine and there's no complaint. And so in that case, if for people who function okay, then there isn't, a need to be concerned. And I will talk about, how to recognize when you may not be getting enough sleep in a little bit. So I do want to touch on the common sleep problems in youth and young adults with anxiety and how to recognize them. So just thinking about the youth, sleep problems do tend to occur in 80 to 90%. When we're thinking about the types of sleep problems in, more adolescent youth and young adults with anxiety, you would tend to notice that, it's harder to fall asleep. It takes a little bit longer than for others. Sometimes it's hard to stay asleep as well. There are times when people wake up in the night. There may be some nightmares, difficulty waking up in the morning, and also just feeling fatigued or tired. Studies that have looked at sleep objectively have been pretty mixed, actually, in youth with anxiety. And so, yeah, so there are some conflicting findings, but one that does tend to hold true and line up with self-report is this finding of, I guess, longer sleep onset latency, which really just means it takes you a long time to fall asleep. So that does hold true in objective studies. And then, so studies that have done polysomnography, so like a sleep study would call it, so sleeping overnight in a lab, there has been some report of reduced slow wave sleep in youth with anxiety relative to controls. And then also just reductions in slow wave sleep being associated with an increase in anxiety and depressive symptoms or negative affect. And, slow wave sleep is important for memory consolidation. So it's definitely important to get that slow wave sleep. So I do want to talk about insomnia a little bit more. So, I've already touched on this difficulty falling asleep and staying asleep that is common in anxiety. For some, it can be, I would say difficulty falling asleep is not necessarily present for everybody with anxiety. We know that. For some, it can be at times, but it doesn't persist. But for others, it can really develop and become persistent over time. And so, when we say, I think insomnia is ultimately used in different ways. It's used more casually. It's used to refer to disorder. So, here, when I refer to it, I'm talking a little bit more about it as a disorder, but it's really referring to difficulty falling asleep, staying asleep, and or rising too early in the morning. And, it would really be present for 3 months or longer and occur for 3 nights per week. And usually, in terms of the length of time of difficulty falling asleep, it's not part of the diagnostic criteria, but a lot of times, people consider if it takes 30 minutes or longer, then that would be a problem. And in terms of, the cycle of insomnia, so this is just one example or one model, but there are many models of insomnia. And I will touch on another one as well. But ultimately, there may be a night where your thoughts are racing, and this leads to poor sleep, difficulty falling asleep, staying asleep, whichever it may be. And then perhaps the next day, you feel terrible. Maybe things don't go as well. And then, because of that, you might place much more pressure on yourself to fall asleep. And, ultimately, sleep is not something that we can make ourselves do. We have to fall into it. It's not, we can't tell ourselves to do that. So, this might lead to just more racing thoughts ultimately, like, oh, well, and now you're worried about your daytime functioning, and, I must get to sleep. And so that is kind of like a vicious cycle of it. But there is also a model by Spielman called the 3P model of insomnia, which talks about just there are predisposing factors, which run from psychiatric disorders to genetic risk factors, just across different domains. And, having an anxiety disorder would count as a predisposing, factor that increases your susceptibility to insomnia ultimately. And then, there are also precipitating factors, which are like things like stressful life events, upcoming tests, things that, raise your anxiety levels, or just, traumatic events, life events. And so, they could lead to a kind of acute insomnia for some. And then, but a lot of people do have acute insomnia, there may be a few days or maybe there's a few weeks, but then there are perpetuating factors. So these factors are really referring to the things that people do to compensate for poor sleep. And so these are, the things like staying in bed longer, or, worrying about their sleep and how they're going to function in the day. And so those types of things can ultimately continue this cycle of insomnia. And yeah, so we know that sleep problems are present across all types of anxiety disorders. I would say they are more strongly associated with generalized anxiety and separation anxiety. Separation anxiety is much more relevant for younger children, but can certainly be present in adults as well, or adolescents too. But generalized anxiety is probably more applicable here. And sleep is certainly a part of the diagnostic criteria for those conditions, but it doesn't necessarily mean that it's endorsed. That particular symptom is endorsed by everyone who has that condition. In terms of recognizing sleep problems, or when sleep is a problem, we can kind of break it up into different parts of the day, but thinking about the morning, it would be difficult to wake up. And actually, sorry, I completely forgot to mention, just if you can put your questions in the Q&A, and then we will address those either during or at the end. It just depends. Okay, so yeah, so in the morning it would be hard to wake up. And then, it would also be challenging to actually get out of the bed too. Certainly you would feel sleepy, more irritable. You likely won't feel very hungry at that time. It's going to be a lot harder to focus on getting ready for school and preparing for the day. And you may also feel some physical symptoms too, like, headaches, stomach aches, nausea as well. And, and those symptoms, often do overlap with anxiety as well too, but you may just notice an increase during school. So, people with sleep problems do tend to skip school or be late for school. So that is an issue. You're definitely going to see an increase in daytime sleepiness, yawning. It's going to be much harder to concentrate, hard to remember information. School performance and grades may suffer as well. And, there may also be some withdrawal from friends too, and some increased aggression as well. Thinking about after school, so definitely going to be, after lack of sleep and, rolling into, spending the whole day at school and coming home, yeah, they're going to have, low energy. They're going to be pretty zapped. They may just climb into bed to like rest their body. Naps are pretty common as well. Or even just, I say falling asleep, falling into a deep sleep. And naps, and I guess I'll cover naps a little bit more later, but they're certainly problematic for your nighttime sleep. And just kind of, just less activity, lack of motivation. And also, you may see some lagging in sports performance too. There are some studies that show that, a lack of sleep does impact sports performance. So that can happen. And then also increased anxiety. Certainly, a lack of sleep is associated with a rising of anxiety too. So now I want to cover a bit about sleep hygiene. So start with meals. So ultimately, one of the things to think about is, which we normally, I guess, recommend for, I guess you hear about it much more with younger children, but I think it's still relevant for adults. But ultimately, you do want to avoid having a lot of liquid within the 2 hours prior to bedtime. And this is because ultimately, remember your homeostatic sleep drive, that is being relieved, that pressure while you sleep. And so if at 4 a.m. you wake up because you need to go to the bathroom, it might be harder to go back to sleep because some of your pressure has been relieved. And that's completely normal that it might be harder. But, if you didn't go to the bathroom, you may not have woken up. So, it is important to still monitor that in adulthood too. But also, avoiding sugar because it is a stimulant, that can be helpful. Making sure just not to go to bed hungry or too full. And, trying to eat dinner at least 2 to 3 hours before bedtime. And just trying to eat on a regular schedule. So remember that, timing of meals can influence our circadian rhythm too. So it's good to keep everything stable. Caffeine. So caffeine, also a stimulant. So, ideally it's good to avoid caffeinated food and beverages after dinner time. I guess it depends on when you eat dinner, but, if dinner were at 6, I suppose. And also, limit intake during the day. Ideally energy drinks should be avoided. And there are other sources of caffeine. So chocolate does have caffeine, hot chocolate, but that ultimately for those types of sources, it may not be an issue. And I do think it's important to note as well that different people have different levels of sensitivity to caffeine and also I guess sleep sensitivity as well, or reactivity. So not everyone's sleep is as easily affected by things going on. And I think that if you don't have sleep problems, then, there are no hard and fast rules, and you may not have to adhere to anything, any particular kind of sleep hygiene or routine. But, if you do have insomnia or, and it's, you have severe kind of sleep problems or are sensitive in that way, then it may be more meaningful to stay on more of a routine and follow sleep hygiene. So yeah, and then another thing about, so caffeine ultimately, even in one study, so even having caffeine 6 hours before bedtime reduced sleep duration by 1 hour. And that was 6 hours. So, so it can still have, even if it doesn't interfere with your ability to fall asleep, it may actually shorten your sleep. So you may wake up earlier, potentially. So yeah, I mean, it has a half-life of 6 hours. So after 6 hours, about half of it is out of your system. And then there has been some research on taking naps and having caffeine before, because it takes about 20 to 30 minutes for the caffeine to kind of kick in and make you alert, ultimately. So alcohol and nicotine. So ultimately, some people might use these as sleep aids or feel like they work as sleep aids. But you really do want to avoid cigarettes within 2 hours before bedtime if you do smoke them, and also alcohol within 4 hours. So nicotine is a stimulant, so it's not really, it doesn't really work as a sleep aid. There is breathing involved. That maybe there's some other aspects of smoking that relax people, but the actual nicotine as a substance is a stimulant. And then alcohol can shorten the time that it takes to fall asleep, but it does disrupt your sleep through the night, and so you can wake up early, ultimately. So those should not be used as sleep aids. Physical activity. So physical activity can be beneficial for sleep and also the circadian rhythm too, but it is important to avoid it within 3 hours of bedtime, ideally. If you're active in the morning or even the after, through the afternoon, it may be, it can be helpful for sleep, but if it's too close, it can actually have an alerting effect and, make it a little bit harder to fall asleep. Another one that people might not think about or might think the opposite about is showers and hot showers and baths. So, I think we tend as a society just think of that as like a relaxing activity, and it is. It feels good, having a nice hot shower, and it feels relaxing. But if done too close to bedtime or lights out, it can actually serve to wake you up a little bit. And this is because they're around the time that our bodies are getting ready to go to sleep. Our body temperature naturally is dropping. And so if you're taking a hot shower, you are raising that body temperature up a little bit. And so that's why it can make it a little bit harder to fall asleep. So that's just another thing to think about. Also, you want to think about just the sleep environment. And, this is, this is probably all things that you've heard before, but, ultimately you want to make sure that your room is dark. If it's not dark or you share a room with somebody else, then, or there's light coming in through the hallway, then you'd want to wear potentially a mask, a sleep mask. It's, a lot of youth have lights in their room, just like fun colored lights now. Like, or glow lamps, things like that. Room lights that kind of, are LEDs and different fun colors, purple and blue. But you don't want to sleep with those on, ideally. So you do want your room to be a good temperature. So ideally between 60 degrees Fahrenheit and 67. Any lower than 54 would be too cold. Any higher than about 76 or so might be a little bit too warm. And then also, in terms of noise, you're not going to want, you're going to want earplugs if there's noises around you that you can't prevent as well. So I do want to touch on technology use because it's a little bit, I would say it's kind of complicated. We do talk a lot about light. So, we know that morning light will advance our circadian rhythm. It will shift it earlier, and evening light generally will delay it and shift it later. Blue light is a little bit stronger at phase shifting than, or I guess short wavelength light is what it, is also what it's called, but it's a little bit stronger at phase shifting than full spectrum or white light. And so, a lot of electronic devices do have blue light. So that's why there's been so much discussion about light and electronic devices, but it is complicated because, there are a lot of different factors going on when people are using this technology. So, one issue is just that, use of technology at bedtime, phones especially, it's displacing bedtime potentially. So, just that means that just the fact that you are using it means that you will be going to bed later. Perhaps if you didn't have it, you would go to bed, because it wouldn't be there. There is also, another mechanism would be that using it does just, mentally and physiologically arouse you, and the content that you're engaged in wakes your mind up in a way. There are also, people have also studied like the alerting effect, the melatonin suppressing effect. So like the ability of this light to suppress the evening rise of your melatonin, and also even the circadian phase shifting or delaying effect as well. But I guess the actual impact of the light on sleep itself is a little shaky. So, especially sleep onset latency. So there was one study that showed that it was like a shift of, I think it was 10 minutes. They showed that it shortened sleep onset latency by, or lengthened it, sorry, by about 10 minutes, which is not a lot. So I think we just need to think about all of the ways in which technology use can really disrupt our sleep. And then also there's some reports now of teens being kind of woken up by their devices. Also, there are friends who are messaging in the middle of the night as well. And, just a lot of text messaging. And then, another thing that people are starting to think about is, there may be increased technology use related to the fact that people are having difficulty sleeping also. So maybe you get into bed and you feel like you can't sleep, and then you pick up your phone too. So I would say it's, it is complicated, but ultimately the point still remains, whatever the mechanism, we all should probably still not use our devices in bed, So yeah, that point still remains. Another thing to think about, it's not obviously relevant for young adults, but at least a bedtime issue, but parents at bedtimes. So, studies have shown that, parental involvement in bedtime for adolescents is helpful ultimately. And so, it's what we do tend to find is adolescents start going to bed so late typically that their parents or have already gone to bed and are no longer involved in bedtime. And so they, there is more of an independence at that point, but the continued parental involvement is beneficial in helping maintain appropriate bedtimes. And another thing to think about also is the family environment too. So a negative family environment, and this is from meta-analysis, is associated with later bedtime, longer time to fall asleep, and reduced sleep duration as well. So those are just, some other things to think about. And then another thing, again, we talked about, we touched on this before, but, the issues with extracurricular activities and homework, there may be a lot of scheduling kinds of barriers to sleep to overcome. And so, yeah, it's important to address these. And also, we need to think about other factors, like one's, there may be a lot of homework, but there may also be variation in one's ability to get it done because of individual differences or executive functioning. So, organization, procrastination. And so it's important to address that. And sometimes procrastination is because of anxiety, so that's another thing to think about. Maybe the person is not that confident about their ability to complete the task at hand. And so they do put it off because they're worried that they won't know how to do it. But yeah, those things do need to be addressed potentially if they're there, or maybe, having too many things going on, being overscheduled, and taking a look at that too. And then napping. So, ultimately teens do nap quite a bit, especially with, the early school start times. So, if you must take a nap, then it ideally should be 10 to 20 minutes. But you have to know yourself. If you can't take a 10 to 20 minute nap, then it's probably, it may be best that you just don't. And, ideally, if you do take one, it should not be after 5 p.m. And yeah, I think you just have to remember that, again, with your sleep drive, that's accumulating, it's building across the day. And then, if you take a nap, it's like filling up your gas tank to half full. So now you are slightly restored, and it may be harder for you to fall asleep that night. And yeah, I think, and for a lot of people, when they take a nap, they're out for 3 hours, and, it's unintentional, but that's what happens. And then they wake up feeling groggy because they've gone into too deep of a sleep stage at that point. So, yeah, it's probably hard to get out of that cycle for some, but it is important to try. It's also helpful to have a bedtime routine, as much as one can. So, I know I've talked about light from devices being, more mixed or questionable, but home lighting does have an impact as well. So just light in general in the evening can influence sleep. And so, within the 2 hours before bed, it's helpful to dim the lights down. And yeah, and especially once you get to the half hour before bed, the 30 minutes, that's when you want to shut off electronics. And I'm just picturing, a teen kind of responding to that. But yeah, I think it could be a tall ask, but yeah, ideally you do want to shut off electronics within that 30 minutes before bed. Reading is good. Listening to music can be helpful. It certainly does depend on the person, but the idea is that you do want to listen to something that you've listened to before. It should not be a new album that came out. Shouldn't be anything novel. Same with books. You want to read something that you've read before. You don't want to read something new that you're really excited to read, and you're just gonna keep going and you're not going to think about the time. And then, television is not really considered, it's often not really lumped into the other types of devices, but you do have to make sure when people today say television, like I watched a TV show, they might be talking about their laptop. So that is, that is lumped in with electronic devices, but the television itself, is, it might be okay, but yeah, you also do need to think about if you actually do have insomnia or not. So a lot of times people listen to music in bed, they do read in bed. If you have insomnia at the level of disorder, then you just want to sleep in bed. You ideally don't want to do anything else. So you just have to think about yourself in that way. And then also it's a good idea to go to bed when sleepy, but not when tired. And I know they're used the same way often, but here what this means is it's really just referring to, when you're sleepy, it means your eyes are closing, you're yawning, you're starting to lose focus on whatever it is that you're doing, whether that's watching TV or reading. Tired is really referring to, you went on a long run and your body's physically tired. So you want to go to bed when you are sleepy, not when you're tired. And then, I'm sure everyone has heard this, this before, but yeah, the bed is for sleep. So you want to sleep only in the bed, even when you're napping. So on the napping slide, there was a girl on the couch. That's a no-no. So you should be napping in your bed if you do nap, although, it's ideal that you don't. Because you want to associate your bed with sleep. And so that's getting a little bit more into stimulus control. But that is what is recommended. And then also, for people who especially do struggle with sleep, it would be ideal to turn out your lights right away once you get into bed. So that means don't go pick up your phone, don't read in bed, don't listen to music in bed, just get in, turn out your lights right away. So that's all about associating the bed with sleep. And then if you are having trouble sleeping, you should get out of bed. And, ultimately, if you do get out of bed, you should be engaged in a kind of a quiet activity in a dim room, or dimly lit room. And again, something routine, not something that is novel and new and exciting, something that you've done before, you've read before, you've listened to before. And, in terms of length of time, it really, that you would wait, before getting out of bed, it really just depends and the reason I say that is because you don't want people to watch the clock. So if you do specify a particular amount of time, you might have people watching the clock, and that's not good either. And sorry, hang on just 1 second. I'm just going to stop my video for a sec. I'm just going to turn on my light because it's getting dark. So. Okay. So another thing, you've probably heard this guidance as well, but this can be helpful, for people who are thinking about, I guess, especially for people who worry, having a to-do list by your nightstand or bedside table, and a pen, if there's, to jot down anything that is last minute, that you're sitting in bed and you think, oh, I forgot to do this. I need to do this in the morning. So then you might be sitting there, without this list, you might be sitting there trying to tell yourself to remember that in the morning and to make sure you don't forget. But that can just be helpful, just to, allow yourself to relax and settle into sleep. Clock watching. So, if you know you're a clock watcher and you hone in on that, make sure to turn the clock away from you, turn it towards the wall or hide it somewhere else. Just make sure the alarm is set and hide it. And yeah, because people with anxiety, but also people with insomnia, they do, tend to hone in on sleep-related threats. and the clock is a big one. So. And then also just touching on sleep-wake regularity and consistency. So you do want your bedtime and rise time to be consistent as much as possible, even when you are sleep deprived. So that means you should not be trying to go to bed earlier to make up for lost sleep. You do want to keep on the same schedule. And in some cases, a little bit of a weekend catch-up sleep can be okay within some limits for adolescents. So within 2 hours, basically. So if the normal rise time is 7, it might be okay to wake up at 9 on Saturday and Sunday, but not noon, so it not too late, because that's when, it causes problems in terms of, maintaining a late bedtime. And then it's also important to get outdoors to get light quickly upon, waking. And that's all about, our circadian rhythm as well. So, and yeah, again, just don't make up for lost sleep by going to bed earlier. So now I want to touch on some cognitive, mindfulness-based and relaxation strategies. So, this is straying a little bit more into, I guess, cognitive restructuring, we would call it. And so this is a part of cognitive behavioral therapy. But because this is beyond sleep hygiene in a way, but because we are focused on anxiety here, I do think that it's important to mention it. And so we know that situations trigger thoughts, which trigger feelings and behaviors in all different types of directions. So when people are worried, they can have automatic negative thoughts or unhelpful thoughts, we would call them. And these are just some examples. So like, I can't do this. I will never be any good. Now everything is ruined. It's all my fault. So these are common worries that people with anxiety might experience. But in addition to that, remember, I also talked about sleep-related thoughts and worries too. So these are some examples of those. So like, I must get 8 hours of sleep in order to function tomorrow. I barely slept at all last night. This lack of sleep is going to make me sick. I'm going to fail the test if I don't get to sleep in the next hour. And so, those are also thoughts that can come up for people who have insomnia, just worries about daytime performance and the amount of sleep that they need to function. And this is an excerpt from a chapter describing cognitive restructuring for insomnia. But this shows examples. So situation in the evening, doing chores and feeling tired. The thought, I really must get some sleep. I have so much work tomorrow. The emotion that they feel, anxiety, sadness, and then the behavior, they go to bed earlier to make sure that they get enough sleep, which isn't helpful. And another example, wide awake at 2 a.m. I might get sick if I don't sleep. I really must get some sleep. Then they get anxious, and then they stay in bed longer to recuperate. And remember, I was talking about people with insomnia do spend way too much time in bed, and that's a big problem. So ultimately, you do want to try to challenge these unhelpful thoughts. So you do, when you're thinking about, anxiety in general, you want to think about if you are maybe overestimating the likelihood that you're going to have a negative outcome. Are you catastrophizing the situation, going into a negative thought spiral? What is, what's the worst that can actually happen? Have you been in this situation before, and what actually did happen? Was everything actually okay? Is this like a minor nuisance, or is this like going to be a huge, catastrophe? what would you say to a friend about this thought that they're having? How sure are you that this is going to happen? And then, when you're thinking about daytime performance and more sleep related thoughts, a lot of this does apply, but, you also want to think about, okay, so maybe you're worried that I'm going to feel terrible after, having a poor night of sleep. Well, there are maybe other factors going on that influence your daytime sleep. It may not, or your daytime performance. It's not, having little sleep is not the only thing. Maybe it's because it's Monday as well and you're in school. How did you feel after a little, a night of poor sleep that was related to a fun event, like a party? Did you feel good that day? So that kind of line of thinking. But the caveat to this is that it's not always so easy to challenge these automatic negative thoughts that we have. Not everybody finds that helpful. And so I will talk about some other things too, some more mindfulness-based types of things. So one of the things that can be helpful is scheduled worry time. And you may have heard of this before, and Psych Central has some good information on this. But yeah, so the idea is that, pre-sleep arousal, both cognitively and physiologically, is really common for people who have anxiety. So, at bedtime. And so, the idea is to practice really noticing when we're worried, ultimately. So becoming more mindful of the times when you're worried about things, and making sure not to judge the fact that you are worrying. So don't, negatively judge it, but, practice present focused, non-judgmental awareness of your worry. Maybe jot down what the worry is, and just, acknowledge that you're having it. And the idea is that you want to try to delay the worry until your worry time. And so, ultimately, a lot of times people feel like, if they worry about something, they're going to resolve it, but then it just ends up leading to rumination, and you're just thinking about it a lot and it doesn't get resolved. So the idea is to find a 20-minute, 15 to 20-minute period in the day that you can set aside to worry. And when you set aside that time, you should not be doing anything else but worrying. So that is one mindfulness-based strategy that can help. And then another is savoring. So savoring comes because it was pulled from the depression, depression treatments, and has been applied to sleep over time. But the idea is that in order to address these bedtime worries, that you would ideally want to identify a very positive time in your life or memory, and you would want to detail it or describe it in a lot of detail. So maybe that would involve writing it down. What happened? Who were you with? What were the scents, the sights, the tastes, all of it. And then in as much detail as you can, what did you enjoy about that time? And you would want to really recite that, to yourself. You would want to, read it through, make sure that it's in your head, and you'd want to practice switching from this, whatever you're worried about, to this positive memory of a life event, ultimately. So you're in a sense, you are changing a channel. So but it does take practice. You have to, you've got to practice switching from the worry thoughts to this memory, ultimately. So, again, some people may find that helpful, others might not, they might not. And so, but the idea is to, you practice it in the daytime, and then eventually you'd be able to put it into place at bedtime as well. And then relaxation training can also be helpful, but certainly is not going to solve the sleep issue. But it's part of, I guess it could fall under good sleep hygiene as well. But so relaxed or diaphragmatic breathing. So that involves breathing in through the nose for 4 seconds and out through the mouth for 6 seconds, and you're focusing on the exhale. And you can see in the image with the pink background cartoon, the woman has one hand on her chest and one hand on her stomach. When you breathe in, your belly should rise, fill up with air. When you breathe out, it should collapse ultimately. So you don't want your chest to rise, just want your belly to fill up with air. And then also progressive muscle relaxation is a common relaxation tool as well. So that involves tensing and relaxing individual muscle groups, and just going through it, group by group, ultimately. And then here are some resources. So helping your child with sleep problems, a guide for parents, the insomnia workbook for teens. We do have a UCLA insomnia clinic, which is affiliated with the Sleep Disorders Center. I believe that they are working with adults. And then we also do have a Think Smart program. So remember, I was talking about, there are issues, organizational issues, scheduling problems related to sleep, executive functioning. So this program does address those issues. In terms of worry, we have the Child OCD, Anxiety, and Tic Disorders program. And then this is just a link to meditation for sleep from Headspace as well. And then these are links to our UCLA Center for Child Anxiety, Resilience, Education, and Support. So yeah, here's an Instagram page, Twitter, Facebook page, and then through UCLA, you can also find it. And you can use the QR code actually to get to the webpage as well. So, all right, well, thank you so much, everybody. So let me.
Emily, if you do have time, we have one question about melatonin in teens. Would you recommend teens taking melatonin?
Yeah, so great question. So ultimately, the popularity of melatonin has increased greatly over the years, as I think awareness of sleep has also grown. And melatonin may be fine for the short term, but long-term use should probably be avoided. Ultimately, melatonin is regulated by the FDA as a dietary supplement, which means that it's not undergone the testing that a psychotropic medication would undergo. And because of its naturalness, or perceived naturalness, I think parents do tend to want to use it. But it does seem like there's an increase in the milligrams that are being given as well over time, that is kind of growing. So, and there's some, theoretically, there's some concern about the use of melatonin, I guess in adolescents or those who are undergoing puberty. So I guess ultimately melatonin tends to decrease during puberty naturally, like our body's production of melatonin. And so because of that, people wonder if taking melatonin might interfere with that somehow. And a lot of that's coming from animal model research. Yeah, so we ultimately do need more longitudinal studies. From the current ones we have, I think there may be 2. It does seem like, there aren't necessarily many adverse, events that are reported, but yeah, it's one thing to study like daytime sleepiness as an adverse event, but the effect on puberty is not necessarily, is not necessarily studied in as great detail, I guess. So yeah, so that's the thing about melatonin is, people tend to recommend just that it's short term. I know for children with autism and ADHD, sometimes higher doses are used, and sometimes it can actually be, it can have beneficial effects for behavior problems or behavioral functioning too. Yeah, but in general, short-term use is ideal. But and people should, and I would just encourage parents to just go consult their pediatrician as well about it.
Great. And then I know we're over time, but if people, there's 2 more questions in the chat, and they're about more specific situations, one with teens in the hospital and how to establish a sleep routine, and with specific times for a teen that is struggling to get to bed on time for an early start time. So I guess maybe if you could talk about how do you maybe talk to teens about establishing a sleep routine and why it would be important for them to, maybe get in the habit of a routine.
Yeah, well, ultimately, you want to find out what is important to them in their lives, and you want to try to link that to sleep. And also, you bring up a great point in this question, and just that motivation is often lacking in teens, and so it can be pretty hard to engage them in these types of treatments. A lot of times people do ask about goals, like what are your goals in working on sleep, and and also what are the, I guess it's called decisional balance, but what are the pluses of, the positive sides of working on it, and what are the negative sides, and just weighing that. And then, trying to, I guess, working on the morning, slightly shifting the morning wake up time earlier is one strategy that can help. So acting on that first rather than the bedtime, and kind of waiting for the bedtime to shift along with it. Sometimes use of light therapy can be helpful. So morning light therapy, although, you just need to watch out for people who are depressed, because you could induce mania. Yeah, but ultimately, there's only so much you can do if they are not truly motivated. But I think, starting with just asking them about their goals in their life, and I think would be helpful.
Thank you so much, and thanks to everyone for attending today. We look forward to seeing you at our next one. We will be sending out information about what the topic will be, and we hope to see you there.
All right, thank you, everybody.